Well, you know, right now, it is all in one man's hands, not the president's hands, a Florida judge's hands, a judge who could rule maybe this very hour whether this health care law breaks some serious rules and should be seriously re-examined. House Minority Leader John Boehner already saying Republicans will choke off funding for this thing if the GOP wins back the House. Constitutional attorney Kelly Saindon says that the law would be on Boehner's side. But would it, Kelly? Isn't that a lot easier said than done?
I'm sorry, I didn't hear you.
Isn't that a lot easier said than done? I mean, once something is law, I hear from other lawyers who say you can't choke off a law. Can he?
He can, actually. It is not an easy process, but he can. If the Republicans take control of the House and the Senate, they can stop appropriations and they can make sure that there's no funding behind it. If you remember, this Obamacare actually was a grand theory that was passed, but the implementation wasn't set up, and the funding can't be set up until it's already enacted. So it's enacted, but there's no money for it, and if they choke the funding, it's not going anywhere.
But wouldn't it be analogous to funding the wars in Iraq and Afghanistan, but that not following up with supplemental funds for the troops? Now, Republicans caught a lot and dished out a lot of hell on Democrats for that apparent double standard. Would they not be guilty of the same double standard on this policy?
Arguably, yes, they would be, but to say that this is comparable to cutting off supplies from our troops, as opposed to them not supporting something that they didn't back, that doesn't jeopardize individuals at a time of war, I think it's a difficult parallel to draw. I
wouldn't be surprised if the other side tries to draw it, though. But let's step back.
I agree with you.
It's interesting, Kelly, because Boehner has gotten a great deal of criticism, particularly from Tea Partiers and the like, who say, you should just try to repeal the law. Quit talking about choking off funding for the law. Is there a difference? I mean, don't they get the same result?
Well, it's a timing issue. If in November the Republicans take over Congress, they can choke it up and not have it enacted. The law doesn't actually go into effect for a number of years, right. And so to repeal it, number one, if the House and Senate, if Congress votes to repeal it, Obama can veto that, first of all. And secondly, by the time it gets through the court system, we're looking at probably around 2014. So if it's in effect in 2013, 2014, and we're so entrenched in it, then it's much harder to undo. But if the Republicans are controlling and they stop it from being enacted or actually practically being applied, it's much easier then to stop it versus waiting for it to run its course and be repealed when we're already acting under it.
This Florida judge has sort of like a narrow scope, not to dismiss the entire health care law, but what?
To say that it's unconstitutional and focus on very specific provisions, because if you can say part of it is unconstitutional, you can throw it out. And if you remember, when this was passed, many states withheld the right to decide whether or not they were going to apply it, and not say that it just across the board applied to them. They were going to analyze it on a case-by-case basis. So this is a challenge of one state, and if this judge rules it unconstitutional, many other states, I'm certain, will follow suit.
Wow. We'll watch closely. Kelly, thank you very much.
Thanks.
Well, your pension